February is Heart Month, and here's a fact that you might be surprised to hear.
About 1 in 100 kids born with a heart defect. Now, before advances in medical technology, babies born with congenital heart defects were not expected to live past their teens. But with those medical advances, children with heart defects are thriving into adulthood. Our mid-morning pediatrician, Dr. Gigi Chawla from Children's Hospitals and Clinics in Minnesota, is here with us to talk about kids and heart health. Dr. Gigi, nice to see you.
Nice to see you. Thanks for having me.
Certainly, this is something any parent of a newborn is concerned about when you get that initial diagnosis that there's something wrong with your baby's heart.
Oh, absolutely. I think it can be one of the scariest things to talk about for sure.
And at Children's, you have one of the largest pediatric cardiovascular programs in the upper Midwest. You see so many. I know I meet so many kids through Kylie's kids that have a heart defect, but we're lucky to have this right here at home.
Yes, we have just a great expertise at Children's, so thank you for recognizing that.
Is it often a heart defect something that comes right from birth, or is it something that could develop in kind of the baby years or toddler years?
Yeah, you know, I think that's a great question, because people often have a question about why didn't I know about this right away?
How did we miss it?
Exactly. But, you know, the heart structurally is being formed at about 5 weeks of gestation, and that's when a congenital heart problem arises. Now, you just don't always know about it right after birth. Sometimes you know about it, you know, if kids are blue or having trouble breathing,
sure.
But very often you don't recognize it for even up to adulthood.
Is there something that you can do? I mean, is there a cause behind these heart defects? Because I'm sure that if you hear that as a parent, you're thinking, what did I do? What did I eat or drink during pregnancy?
Most of the time it really is genetic. Like moms or dads who have a congenital heart disease themselves have a higher risk of having an infant who does. But other things are certainly under control, like you know, drinking or smoking or using drugs, all of those types of things. Then there are things that are not under their control, like an infection can also cause a problem like that.
Every once in a while we hear about an athlete who has a heart attack during a game or something like that. It's always heartbreaking, and you think, you know, these kids, you have physicals for sports, you have all of these screenings when you're a newborn. Are there screenings that can catch these things, or is it something that sometimes just presents itself?
Right. So, you know, approximately 750 kids die of a heart attack while playing sports each year in the United States. So it's a small number, but it creates a lot of
it's heartbreaking
and anxiety.
A lot of coverage, too.
So, you know, I think the things that are clear about it is sometimes it's caused by a heart problem, and other times it's caused by drug use or asthma or other problems that can cause a heart attack. For the ones that are caused by a heart problem, it can be really tough to sort those out and to recognize it, because the symptoms can be really vague. Things like fatigue. You know, lots of teenagers are fatigued.
Yes.
So what can parents do? I mean, can you do anything to prevent something like this happening to your child?
Yeah, so the first really is make sure kids get a sports physical before they're playing sports. It's just the best thing that they can do to be screened and make sure that they're really okay to play. Encourage your kids never to smoke. That would be another thing.
Sure.
And then really be up to date and understand your own family history.
Important topic this month for sure. Thanks, Dr. Gigi.
Thanks for having me.
You don't want to spend all of your